Hi everyone. We're just waiting for a few more participants to log on and then we will get started. A few more people waiting in the lobby, so I'll just admit them.
I'll set a timer for myself, Caoimhe. So just in case. But you can
How much
stop
time
me.
do we each have actually?
Around
10 minutes.
10 minutes.
10 minutes.
Around 10 minutes.
Ah, plenty of time.
Yeah.
I'd probably be less than that.
No, Michelle, jump in if
Super. So thanks so much for everybody for joining so far. I appreciate lunchtime is precious, so please feel free to, eat your sandwich and drink your cup of coffee as well. Your cameras and your microphones are off, so you're free to do whatever you wish. Okay, so will we get started? Yeah. Okay, great. Well, thank you very much, everybody, for joining our webinar today, Expecting the Unexpected with Public Patient Involvement. My name is Caoimhe Byrne. I'm the Public Engagement Manager at APC Microbiome Ireland, and we're a research centre based in UCC in Cork. As our name kind of alludes to, we are investigating the role that the microbiome has on predominantly human health, but also on animal and planetary health as well. And I suppose one of the key aspects of my role is trying to encourage and support our researchers to embed some engaged research practices and principles into their research and their projects that they're carrying out day to day. And as we all know, there's a bit of a research kind of culture shift, and we're trying to broaden our research so it gets out from the four walls of our labs. We're also a local partner within the PPI network here at UCC, and we work closely with Emmy and all that team. So I guess the idea for this particular webinar came about last summer when Siobhain and I were collaborating on a project, on an event together. Siobhain will speak a little bit more about that in just a minute or so, but I suppose in my role particularly, I support researchers to kind of carry out PPI, and how do I do that is by reading all the literature, signing up to the PPI Ignite network newsletters, attending the facilitation workshops and all the webinars, following the right people on social media, touching base with the PPI network and our local office, and I suppose kind of being up to speed as possible, all things PPI. However, that's all well and very good in principle and practice and on paper, but we have to remind ourselves every now and again that we're not just dealing with, I suppose, a strain of bacteria in our labs. We're working with people, and people are unpredictable sometimes. And we remember that there's emotions attached to a lot of the circumstances that people find in the room with us. So without that, I'm going to hand you over to Dr. Siobhain O'Riordan and her colleague Louise Collins, but Louise is also wearing her patient hat today, so they're going to give their perspectives on their PPI project that they're involved in. And then shortly afterwards, Michelle O'Riordan, who is a research support officer at APC, she is also leading another PPI panel for the Augment project and that team, and she's going to chat a little bit about her experiences to date as well. So over to you, Siobhain, please.
Super. Thanks so much, Caoimhe. And this is a really super opportunity as well. And I suppose I was new to public and patient involvement in the real person sense. I suppose for this one event that I'm going to talk about, I had carried out public and patient involvement. I started during COVID, actually. So a lot of it was actually online. So what I'm going to speak about today is, I suppose, some of the lessons I've learned, some unexpected lessons and unexpected experiences that we learned through our endometriosis conversation cafe. So endometriosis is a disorder that affects women of reproductive age. It occurs in about 1 to 10 women of reproductive age, and it can be an extremely debilitating disorder. There's a long list of symptoms that affect people's well-being and quality of life. So I have a PhD student in Edinburgh working on a project around endometriosis. And I'm a neurobiological scientist, so it's a scientific program really of work that this student is carrying out. She also has gotten really involved in some media training and PPI there as well, but I was really only involved in the scientific elements really. So this was my first foray really into real public and patient involvement in person. So with Quiva's help and the rest of the APC, we organised a conversation cafe, and I wanted it to be a relatively informal situation. I wanted to give the patients and the public that were involved and attending our event a voice. I also wanted to give them some information to take away as well, and in part, I suppose, ideas and concepts of what type of research we were carrying out. And to be absolutely honest, in Ireland, we don't have an enormous amount of endometriosis research, so I did want to highlight research that was also being carried out by my colleagues in Edinburgh as well. So what I did was I kind of figured out that maybe, what information did people want? I did some of this alone, but then I also did it as well with my PhD student in Edinburgh, because we had chatted to some focus groups online, as I've mentioned, and she had done a lot more interactive engagement with patients than I had. Then I also spoke to my wonderful colleague online here as well, Dr Louise Collins, both from an academic point of view, but also from a patient point of view as well. And she's going to feed into some of this presentation as well, to give her perspective from those two sides as well on how the event actually worked. So the event was wonderful actually, and very well organised. I had a super team. I have researchers in my lab that are very interested in being involved in organising these types of events, and I think they're very curious as well to see what patients will actually say, or what public people in the public eye will actually say about our type of research as well. So we had an ongoing project in Cork as well, and the ongoing project in Cork as well was looking at inflammatory mediators and also vaginal microbiome in endometriosis. We were recruiting for that study for about 2 years, and we only got 30 participants. So recruitment was a major issue. So I really wanted to ask individuals at this conversation cafe as well if they would be interested in being involved in a public and patient involvement panel to inform our research and recruitment processes as well, because I actually organised this project in Cork without any PPI. I spoke to clinicians, I spoke to scientists, I spoke to many other people, but didn't bring in much public or patient involvement into it at all. So we really needed to get a PPI panel together. As I said, the other element was to impart information. So I invited, it's a bit small here, I'm afraid, I invited my wonderful colleague, Dr. Andrew Horn, who is a world expert in endometriosis in the University of Edinburgh, and he heads up the reproductive centre there as well as being the head of EXPECT, and a number of other different amazing strategies as well with regards to endometriosis research. And he's just one of the leads as well on the project, where we got nearly €7 million from the EU to investigate endometriosis at an EU-wide project forum. So my other colleague as well that I also asked to speak on the day, so Andrew was speaking about endometriosis in general from a clinical point of view, and he was also speaking about his research and the type of research he'd like to see. Dr. Kathy Burke is an endometriosis expert here in Cork, and she was speaking about it from her perspective as well. And she's also carried out some research here as well. I spoke about from the microbiome point of view, how the microbiome within our bowel is associated with our immune system, potentially associated with the inflammatory, stress and pain components with regard to endometriosis. We also had a patient dial in from Colorado as well, and it was a very positive story really from the clinical point of view from that patient as well. And we also had somebody from PPI Ignite join us as well in the evening. So what we had was a table set up, and we had a number of different topics on the tables. And the topics were informed by my colleague Louise here, and also by the PhD students that I mentioned. So we had round tables like this. This is really what people are discussing after the talk. So we had the 4 talks, and then we allowed people to discuss amongst themselves. So my concept initially was to have a topic on each of the 8 tables, and then to say, well, go around to different tables when you're having your tea and coffee on the break and see which topic then you'd like to sit down and talk to each other about. What actually happened was, I think 5 or 6 of the topics were picked up and put onto one table. And again, I'm not a control freak, but I had my own ideas about what might be good for people. But again, this is all learning. Louise is laughing because this is Louise in pink. It was really, really, really helpful at coming up with the topics, but also as well driving the conversations at each of the tables as well. So the conversations were allowed to flow for about 20 minutes, and then the individuals were feeding back from the tables at the end of the 20 minutes. I don't have pictures from when I didn't want to take pictures from the feedback sessions, because there was tears, not only just patients, maybe my own coming to my eyes as well. These are the unexpected bits coming to you now. So literally there was moms, there was patients, with a large amount of emotions, speaking quite loudly and with a lot of emotion, really at the clinicians. So at what I thought and have proposed to the audience of the evening, to experts in endometriosis, the people and participants and the moms and the researchers on the evening were asking these people and me how we can call them clinical experts when there is absolutely no current effective treatment for endometriosis. People are bounced from pillar to post with regard to, really, is this not just a period pain, or should you not just get pregnant to relieve your pain? But the perspectives that were presented on that evening were absolutely shocking from an emotional and a need to have a voice point of view. We had some people like Quiva and also Tanya Mulcahy from Health Innovation Hub who stood in and provided me with advice on how to probably control the emotions and the outbursts. But that's the way I saw it, were that they were outbursts. Immediately when the conversations or the feedback was finished, the two clinicians sat down with the participants at the table and spoke to them. And I actually thought that was really heartfelt as well, that they immediately wanted to see, what they could do, at least in just that instant as well. So we gathered information on the evening, which was really helpful about what they wanted to see. Women wanted to have a voice. They wanted to be heard. They wanted to know about not just the really positive patient story that we presented them with, but they wanted to know what other people were suffering from and how they were actually getting on, and how we as researchers and clinicians were going to drive this research forward. So I think lessons learned, not only have trained people, because we had our whole support from the APC, well trained. None of us had run endometriosis conversation cafes before. So I suppose it's going into it with an open mind. I could have collected feedback a little bit better, I feel, ensure the perspectives are collected as well. I didn't really collect the perspectives of the patients, which Louise is going to give you now in a second, which I think is key to me understanding what women want going forward. So with that, Louise, are you happy to say what you think and your perspective from the evening, if that's okay?
Thank you, Siobhain. That was a lovely overview of the event. So this is really new for me as well, because obviously today I'm speaking as a researcher in the field, as a facilitator, as Siobhain mentioned at the event. But most importantly, I'm here for as a patient and patient perspective, having been diagnosed with stage 4 endometriosis myself. So as Siobhain alluded to there, it was a very challenging conversation on the night. Many of the women in the room, including myself, have waited, 8 to 10 years for a diagnosis, and they're not used to being heard. So they felt let down by the medical profession. They felt really unheard, and understandably, then they were really, really angry, and that came across during the evening. Siobhain did mention that there were structured topics that were provided for conversation. That's how we envisioned that the night would go. But in the end, all the women, just really wanted to talk about their own journey, about their own personal experiences with endo. And for me, as a patient perspective, because I definitely wore my patient hat when I was in there with all the women, was that Siobhain was really, really flexible. So we have two different insights on this. And rather than insisting on sticking to, a very rigid preset structure, she really allowed the conversation just to flow organically. And for me as a patient, I felt that that's when, that real connection actually happened in the room, because it was allowing it to be flexible. And then all of us felt like our voices were actually being heard. It wasn't contrived. It wasn't just what, Siobhain wanted to get from the evening. You were facilitating us, our voices were being heard on the night. So for me, the discussion was much more meaningful. It was much more empowering for all of us. We talked about what really mattered to us and not just necessarily what the scientific community wanted us to talk about. And then because Siobhain allowed that to happen and allowed us this platform to express ourselves really, really openly and rawly, actually, so it was uncomfortable. But I know that everyone there then felt much more connected afterwards, much more willing then as well to engage in all of the research that's upcoming in UCC moving forwards. They just felt heard. So that was really, really important. And I guess my really brief perspective then as a patient is that by, embracing that unexpected and allowing for flexibility during your PPI conversations, it can actually lead to a much deeper, much more impactful outcome for you than trying to stick to this rigid structure. So just by going with the flow sometimes is going to be much more beneficial to everyone involved. And that's how I think the patients felt, which was probably very different to how Siobhain felt. Like if I was wearing my researcher hat, I would say that I was shocked and surprised at the emotions. But being a patient of it myself, they were speaking my language. I mean, it was I was also angry and probably, feeding into that. But overall, it was exactly what that, group of people needed at that time. And I think then they engaged with Siobhain much better because of it.
They're amazing since, absolutely, and helped us get our EU grant, actually. Thank you so much, Louise.
Thank you, Siobhain.
Hi, everybody.
Oh, sorry, I was just going to say now, I was waiting for the slides. I'm so sorry, Michelle.
No, you're fine.
So once the slides come up, I'd like to introduce my wonderful colleague, Michelle O'Riordan.
Hi, everybody. My name is Michelle O'Riordan, and I'm a research support officer here in APC Microbiome Ireland, and I work under Professor Sorodagosh with the Augment research team. So the Augment program, we seek to understand and modulate the gut ecosystem by developing some precision foods and supplements to optimize immune responses and improve treatment effectiveness for people with chronic inflammatory diseases such as IBD. So we have recruited a group of experts, and by that I mean individuals with lived experience of IBD, to sit on our public research engagement panel, also called PrEP. So I'm really glad to be here today to share with you. Oh, it looks like I've lost my slides here. Hold on. Let's move forward here. So I'm really happy to be here today just to share with you a few examples that I've had in the past with just the unexpected, and just to share a couple of tips and tricks kind of that I've learned after the fact, of course. So I would say probably the most severe issue that I've ever come across was actually in a previous role where I worked with one of the larger homeless charities in Ireland. And there was a research partnership developed to conduct an engaged research project related to mental health and homelessness. With this project, individuals with experience of homelessness were actually trained to conduct focus groups among the homeless population within the charities. So to go around to the different housing that was available and to meet with people and discuss their mental health and the effects it may have had on their homelessness. So as you can imagine, this is a very vulnerable population and also a very sensitive topic. So unfortunately, what had happened in our situation was one of our members who was trained to facilitate the questioning and the focus groups was actually triggered and resulted in a relapse. So of course, this is a major kind of unexpected outcome that we had. And I'll talk a little bit about some ways that we can kind of maybe work around those types of things shortly. But we have to remember that not all of our research, some is a little bit more social based, and we are working with very vulnerable populations, and just thinking about the topics when we're doing both just small meetings and also larger group events. Are those topics sensitive, and what kind of supports do we need to provide? And then on the complete opposite end of the spectrum, not every unexpected event is quite so serious. So for example, with Quiva as well, we hosted a conversation cafe, I think it was last spring or maybe the spring before, where we actually had a good number of people registered. We had planned to basically, have roundtables again, a setup very similar, where we would have a series of questions at each table. We kind of expected, 6 or 7 community members at each table, with 1 to 2 facilitators at the table as well to help facilitate discussion. But on the day, there were several factors that we just didn't anticipate. One being lack of parking, second being difficulty finding our location, and the very rare hot, sunny spring evening. And as a result, we ended up with only a handful of people. So, of course, we had to make a lot of very quick changes in how we conducted the evening. So I've learned that it's, always best to just expect the best, but, prepare for the worst. So that being said, can everybody see my slides okay?
They're not coming up for me, Michelle, but let
me try again. I keep having to click this link to presenter. Can you see them now?
Have you take control? Or will I do it and I could click them on for you?
Sure. Yeah, I've clicked everything, but for some reason I keeps going off of it.
It says you have control there, so yeah, I'm seeing them now.
Can you see them now? I'll click on for you. I'll click it on. Prepare for the worst. Is that okay?
Yeah. So we're prepared for the worst. So great. So again, we expect the best, but just be prepared for the worst thing to happen. So I put together just a few things that have worked well for me. Obviously, they're not always going to work, but I think just trying to be as prepared as we can for worst case scenarios is always great. So when working with just an individual group, I think some of the tips that I can give that I've found to be working very well with the group that we have right now is, number one, have a term of reference, so a way of working with the group and let the group develop this. So this really should be something that's provided by the group for the group. And in addition to that, just setting ground rules, and as needed, reviewing those ground rules. So if I notice that something is coming up and maybe we need to readdress something, then we can take a look at it and go from there. And in addition to that, just trying not to do everything by myself, making sure that I have a co-facilitator on hand, whether it's, kind of, I like to invite somebody different from our research group to kind of join, and they can kind of introduce themselves. They get to then, one, it's great for them because they get to see what the panel is doing. They get to meet people in the community who have lived experience. And two, those people get to ask questions that I might not be able to answer. Like if I have the nurses coming in, they're able to, ask a few questions that I wouldn't be able to answer. And when it comes to the larger groups and events, a few of the things that I've learned would be, make sure that the members of your team, have a good idea as to what's going to happen. Make sure that they're prepared. So if I have any invited speakers, and I know there's going to be question and answers or discussion going on, I like to make sure to provide them with those questions in advance so that they can have time to think as well and kind of prepare what people might want to ask of them in their specialty. In addition to that, I'm always thinking of it if it's a sensitive topic. What supports do I need to have available? Should I have links on a slide, maybe? For example, if I'm going to be talking about something that's very, I don't know, if you're talking about something where there could be suicide or other things going on, it might have links to certain supports available on a slide, just in case anybody's triggered and they know where they can go. So just signposting people to the supports if needed, knowing them, if you're not going to have a slide, just kind of knowing so that if somebody does get upset, you can link them to the correct place. Thinking about the audience and their subject matter, it's just really important. Let people know that they can participate as little or as much as they feel comfortable at the beginning, so that they kind of know, okay, maybe this is a little bit too much for me. I'm going to just step away and maybe I'll come back, at a later stage. And making sure that they know that that's okay. And again, not trying to do everything myself. So with our last event, for example, our PPI panel, I said, I'm going to use them. I mean, I have them, they're the experts. They really know what people are going to want to talk about, what they're going to want to listen to, not me. So ask them, who would be a good, what kind of topics would they like to hear about? If we're going to bring in speakers, what do you want to hear? What discussion questions should we have? Give me a good set of questions, and then letting them know as well to kind of be on hand to help provide support, having them, checking in people, and having the visibility. And then the same for any staff that I have. So for our research team, we like to have them there and making sure that they're not all sitting together and that they're spread out and that they're interacting and available, but also making sure that I'm discussing with them in advance of the event, what they should expect, because the researchers aren't used to it. You've got PhD students and we've got postdocs who are used to, kind of being in a lab where they don't have to interact quite so much. So sometimes it's really good to make sure that they know it's okay. They're not going to be expected to do, to stand up and maybe give presentations, but that they should be on hand and be able to answer questions and just talk and learn and listen. And then in addition to that, even food. So for example, we do with IBD. So, my panel members, when we do anything, I go to them, what kind of menu should we have? I mean, for everything, it's important, that they're the ones really, making the decisions, because I'm not the expert, they are. And then always having a backup plan. I mean, that's probably one of the biggest things I can say. Luckily, for example, when we had very few people show up, we just said, okay, we're going to move some of these questions. We'll whittle it down a little bit. And we'll move from, our 6 tables we have set up down to just 2 tables. We'll divide the staff that we're going to be at each table differently, and we'll just make it work. And it did. And it was, even though we only had a handful, the discussions were good. They were informative. Those who were there enjoyed it. The researchers really enjoy hearing the stories and learning that there's more to what they're doing, and that what they're doing has meaning. So at the end of the day, it works really well. And then, of course, evaluating and debriefing after every meeting and every event. So even after each of my meetings, I make sure whoever's there with me, that we kind of talk about how it went. Was there anything we could do differently the next time? Is there anything that should be addressed? And then for the larger events, having an actual paper evaluation is always very helpful as well. And then just remember, last but not least, if you can, that mistakes are just proof that you're trying. So sometimes no matter what you do, mistakes are going to happen, unexpected is going to happen, but that's okay. We learn and we move forward. And that's me.
Super. Thank you, Michelle and Siobhain and Louise, for those great presentations. We have a couple of minutes left. If anybody wants to pop a question or a comment, or maybe share your experiences in the chat, please do so. Or alternatively, if you want to raise your hand and I can unmute your mic if you want to ask the question in person. That's up to you. But I think for me anyway, the definite take home top tip for me would be to be flexible, I think, and to adapt and be okay with adapting as well. Yeah. And as you said, Siobhain, just to try go with the flow a bit more, even though it goes against everything that you have, the way you're used to working, or or you have a hard list of topics or whatever, and you have your tick and you want to tick them all. But I think it just shows for sure, and the same with the events, Michelle, that you and I were involved with last year, is that okay, we didn't get the numbers that we expected, but I think you worked very well, but quickly adapting. And again, we'll learn from that, and the next time we'll make sure that we don't host it in that particular room, because people can't get parking, and and it's fine. And even though it may have felt like a disaster at the time, like that, when you think about it and you evaluate and you get people's feedback, there's always some positives, I think, to be gained from it.
Always.
Yeah, absolutely. And I think someone put into the chat there, sharing more examples of the unexpected is really valuable as well. But then I suppose asking people, because we asked for feedback on the day, but I suppose then I never asked again, maybe a week later. But it's only that I have I'm so lucky to have Louise in my building that, we've had these conversations. And then I was like, okay, actually, it's not all, it wasn't, and I don't mean it was for me, but it was from, I feel, good about imparting information to people and giving them a voice. But that actually, you may as well dissolve that. It was really about the patient on the evening. And I only found that out later, I suppose, how important that was and how okay it was. And then the flexibility was key to that. And that was because of Louise, actually.
And I suppose that, sorry, Louise, that just feeds back.
No, I was just going to say, I think Emmy's put something in the chat.
Yes,
but,
yeah. So I suppose that kind of leads nicely to Emmy's question, Siobhain, that do you think that this has changed the approach that you now have with research and the PPI?
Yeah, I think it has really, I suppose. I think there's a lot more chat to have with patients and participants prior to organising of any event. You know, we're organising another event, a menopause event in this month, October, the Jazz Weekend. But again, I would have chatted to a lot of people that would be attending the event. And that's kind of, I thought it would have been backwards before, that, you know, you'd have a surprise for people at the event, but no, actually, they need to tell you what they want from it. So yeah, it just means there has to be loads more conversations before you actually organise an event. And you know, I mean, there are certain concepts you still have to get across because it's your research and you want them to know what you're doing. But again, just much more informed by the panels that we've generated and just giving people a voice and really taking the time to allow people to tell you what they want for the event. It makes me extremely cautious with certain groups, I suppose, and but you know, that's just it is just the way it is. But you know, I'm more prepared now going forward, and you know, each group is diverse in itself as well. I think the group we'll have will be mainly perimenopausal and menopausal for the October event, which may be different to the endometriosis group, but I don't know. But again, it just means that you have to be more flexible and be open and be prepared as well. And I have a lot of different individuals that have experience. Again, Quiva as well is really helping with it, organise this event as well, but also people that have a lot more experience as well coming to this event as well, which yeah, changes it a little bit. Emmy, thank you.
Super.
Can I just add one thing to that? I know we're probably out of time, Quiva, but just to Emmy's point, like, did it change our approach to the research? I think it did, Siobhain, in the, you know, we're at the moment setting up an observational clinical trial with the endo cohort people, and we would never have assumed before that they would have maybe been willing to and give as many samples as we're asking for, and having engaged with them and talked to them at that event, we're now asking for much more than we would have previously thought that we could ask for in different samples. So that wouldn't have come about, and we wouldn't have done that or expected that if we hadn't talked to them.
Exactly.
They're just very engaged. So that was definitely a positive outcome to come from that as well. And it did change the research and the protocol.
And help with recruitment.
Exactly.
Yeah.
Super. Great. Thank you, ladies, for providing that perspective. But I think, we're pretty much out of time, so we'll wrap it up there. But I'm sure if anybody has any other questions, or you kind of want to take it offline, I'm happy for you to email me, or I'm sure Michelle and Siobhain and Louise will be happy for you to contact or connect with them outside of this webinar as well, to share some more tips and tricks with you. But again, that's all from us at APC and UCC. Thank you for joining, and thanks to Emmy and the PPI network for providing us with the opportunity to share some of our experiences. I hope you all found it worthwhile.
Thanks, Quiva.
Okay,
Thank you.
take care.
Thanks, everybody.
Thank you.
Bye-bye.
Thanks, everybody.
Thank you. Thanks, guys.
Bye.